Okay, so I'm going to talk about research, and I thought I would go unscathed from Dr. Cox, but no, unfortunately, I thought Hambley was going to take the bulk of it because he's younger than me. He has no gray hairs, so work a little bit longer with Dr. Cox. Okay, so we'll talk about research in general and then in Hamilton. Next slide. So we'll talk about the Hamilton Scleroderma group, which you can see, this is the logo down here. We came up with that logo. Maggie might explain the logo to you later. So who are we? We're clinicians, researchers, educators. You can see us joining hands tonight here. So we have three big things: improving clinical care for our patients locally, trying to get prompt access to the team of dedicated experts, and Nathan Hambley's the newest, and bringing the pulmonary hypertension clinic over from the general over to St. Joseph's has provided us as a location where we're together. We want to enhance scleroderma education, and you're seeing tonight as a result of that too, both to patients but also to other clinicians, to nurses, to allied healthcare, and increase our understanding of scleroderma through research, both basic science and clinical. So this is our mantra, leading the way in patient care in the treatment of people living with scleroderma. So we're both at St. Joe's as well as McMaster. And if you go to the website, I think the HSG website, you'll see this. Maggie had referred to rheumatology as being the quarterback. Dr. Cox may not like that, but we're at the center. And you can see all the professions around us: respirology, nephrology, gastro. We can't do this alone. Rheumatologists can't do this alone, and that's why we have a lot of collaborative clinics together. Next. So I started off with in Hamilton with the CSRG, the Canadian Scleroderma Research Group, and it's gone through a lot of evolution. Still has a lot of impact. A lot of you are participating in the CSRG. When I first started, it was everybody with scleroderma we were entering, but now we're being more focused. We've got more information, and we're coming at it with more, not the longer term, but we're looking for information in the newer patients. Next slide. So started in August 2004, so that makes us about 17 years now. Comprised of annual assessments, scleroderma patients diagnosed by a rheumatologist, and are entered in this database. Next. So we collect almost 1,500 pieces of information, and this is in a big database. And it's still a very valuable asset, and I'll show you some of the publications just over the last year. And more and more we go along, the more and more questions are asked, and it's very easy access to pull this information. Next slide. So this is just over the last year. So I pull this up. You can see all the different types of information. So one is the top one, you can see appearance and scale, and then the second is a basic science. Next, this one here, these antifibrillin antibodies. Dr. Kokar talked about these antibodies. These are newer antibodies, looking at some of these scoring systems, calcium channel blockers, and looking at mortality. So this is all just in the last year. And so many publications, 128 over the last 10 years, so about 13 per year. Next slide. So we talked a little bit about this last year. SPIN study is still going on. If you're not involved, you really need a computer here for this. Many of our patients are approached and are entered. If you're not, you should enter it. There is the website up at the top there. And it's an organization to help with some of the coping skills, those annoying symptoms that Dr. Larche talked about at the beginning. coping with stress, hand function, fatigue, pain, body image, really involving patients in research rather than just physicians. Next slide. So again, the objectives are to learn more about problems that you have in a daily basis, fatigue, emotional distress, physical limitations, and to develop some internet-based programs. Okay, so that's that portion. So here in Hamilton, just to recap from last year, Dr. Mark Larcher is looking at how immune cells trigger fibrosis and scleroderma, and Dr. Maggie Larcher has told me that they're recruiting now for both limited and diffuse, so all patients. And not only do they want your blood and urine, but now they want your poop. So Dr. Kolb is looking at the link of lungs and its link with skin. Dr. Ask, who's very good at operating the computer, but that's not his day job. His day job is looking at immune cells and their interaction with fibroblasts. And Dr. Margetts is a nephrologist, and as you've heard, not as important because he solved all the world with scleroderma. But he's still looking at how fibrosis affects the kidneys and scleroderma. So always looking for recruits. You can contact Andrea about some of the studies that we're doing if you're interested. Okay, next slide. We're looking at, through the CSRG, we're looking at calcinosis. So if you're coming and you're part of the CSRG, we'll offer you the SPIN study, the database, and now taking hand x-rays and examining, you're poking at your skin the way Dr. Cox finds very intrusive. So we want to know more about that calcium that's deposited. So next slide. So really, we're looking at this natural history, the annual incidence, looking at radiographs and seeing if we can tie that in somehow with more information. Next slide. We have this study on riociguat. You saw it flashed in Dr. Handley's slides about pulmonary hypertension. We just finished, I guess it's closed now for using this drug, but that's the phase 2. We've just been approached for doing the phase 3 trial. So pay attention, and if you have diffuse scleroderma, you could potentially become involved in this drug. Next slide. So those results will be coming probably in the next year. Next slide. And so we just looked at the best dosing. So there's a variety of dosings here. So that's what a phase 2 is, to suss out the dosing and suss out if there are any major side effects. And then the phase 3 is to really look at how effective the drug is with the ideal dosing. Next. Dr. Cox talked about nintedanib. So we've just also participated in this, and it's now closed to new recruitment. This is for scleroderma patients with lung fibrosis to see if it works. It works in pulmonary fibrosis in IPF, but we want to see if it's in scleroderma. So although this has closed, we are recruiting for other trials in nintedanib in a variety of patients at St. Joe's. So when you come to the interstitial lung clinic, you'll be approached about seeing if you qualify for some of these, and we'll come to you. Next slide. So nintedanib will be looking both at the pulmonary function, but also at the skin and the skin fibrosis. Next slide. So lots of, with rare diseases, you need lots of countries involved, you need lots of patients. So 20 countries, 200 sites, 520 patients. So it requires a lot. Next slide. I think this is the global. So 5 sites in Canada and many sites all over the world. Next slide. And really we're looking at lung function, fibrosis, but also possible risks. So that's that phase 2. So it's looking that it's worked out well, so we can move on to the phase 3. Next slide. Okay, I was asked to talk a little about stem cell. There is a lot of excitement about this. There is 2 trials that I'll talk briefly about, and so this is not for every patient with scleroderma, unfortunately, but it is for that select patient. You can't have too much damage and you can't be too well, so we have to catch you at the right time to consider this. So what do? Well, they administer, so I think Dr. Kokar talked about the stem cells, so those are the ones that have all the information in it, and you want to collect those. So you want to prime it, you get some medication to prime it, you take them out, and then you freeze them, and then you get chemotherapy to really knock out selectively your bone marrow, and then they'll return your stem cells back in that haven't actually been affected by the immune system yet, and they sort of reset your whole immune system, and that resetting then allows for it to forget what it did before. Okay, so next slide. So the 2 studies, this one's been published in JAMA, this is in this Journal of American Medical Association in 2014, but it took a lot of investigators, you can see. Next slide. So 156 patients were randomized, so they were randomized either to getting the stem cell or getting high-dose cyclophosphamide. And these are patients who can be pretty sick. So you can see that in both groups there were deaths, 19 in the stem cell and 23 in the cyclophosphamide, and then also the irreversible organ failure. So that's just the nature of the disease here and the severity of the disease. So it appears, though, in the long run, that stem cell was superior to getting cyclophosphamide, and there were a few more treatment-related issues with the stem cell than the control group, but again, in the long run, appears to be conferring long-term survival. So next slide. So this has not yet been published, or I couldn't find a publication, but it's been presented at the American College of Rheumatology. This is the North America trial, very similar, and so, next slide. It's called the Scott trial. So 75 people were randomized once again, and the conclusion was pretty similar. So as a result of these 2 trials, the CSRG lead, Dr. Barron, has approached almost everybody in Canada to see if we can come up with a national policy at each center to try and get stem cell. So in Ontario, we have to send you to Ottawa, and I think we've sent a few people there. And they follow very strictly these trials, and so very few people have been accepted. We are working, Dr. Marche is working on getting stem cell transplant done here. We've identified our hematologist, but perhaps with this national initiative with bringing everybody in and talking at the table, that it will arrive in Hamilton sooner than later. Just quickly, we talked about this last year. If you come to the Firestone, we'll approach you about getting involved in the scleroderma and lung ILD database. Next slide. And then the CSRG is proposing to do a trial in looking at bacterial overgrowth in your stomach. So that's called SIBO. I think Dr. Marche is doing a smaller project, but we think we're going to participate in this trial. I'm not collecting food from here, so don't bring me your food. Bring that all to Dr. Marche's office. Not Dr. Cox's office, please. This is to give antibiotics to people who have upset stomach, particularly diarrhea, the major symptom. We don't know the right treatment regimen, and that's what I think we're going to try and find out. Next slide. So that's so trying to get 26 sites. Next slide. Oop, these are all next slide. That's back to the ILT database. Next slide. So I went to this site where all research is that's registered in the US or in the world. It's called clinicaltrials.gov. So right now I typed in how many are active out there for scleroderma. Well, there's 65 trials out there now in scleroderma. So I just gave you the top 4 there, top 8. You can see the registry, calcinosis, another drug called Vigatran, atorvastatin, still another stem cell transplant looking at different drugs as well. So lots and lots of trials that are out there. Next slide. So it's my last slide. So we're very happy here that all this research is being done. We're looking very positively. As you heard, many positive comments from Dr. Cox, Dr. Handley, Dr. Marche, from Maureen, but we will have to work together. So cure for scleroderma will not happen without a collaborative research effort. And then you see the logo, the Cure Scleroderma. Hamilton scleroderma experts are participating in these research efforts in full force, and many studies are in the works, coming closer, so stay tuned.